All right. Well, thanks, Amy, for agreeing to do this. I'm really excited to just chat with you more about hot and cold exposure. I know it's something that we're both big fans of, that we have come at it from very different angles. Maybe to start with, do you want to just kind of give a little bit of background on yourself, and as you sort of weave that in along the way, how also hot and cold sort of came onto your radar through your medical and otherwise journeys?
Yeah, well, the first time I went to a sauna that wasn't like some creepy back of the gym kind of a sauna was in Germany, where they have a sauna culture.
Yeah.
And it felt just wonderfully social. It was my party trick that anybody coming to visit me when I was there in college, I would take them.
Hey, come check this out. This is different.
Exactly. Yeah. And, I think it struck a chord. It was something that drew me to come back.
Yeah.
Right. So without the language of like, hey, this makes you feel better, it was something that drew me regularly.
Yeah.
Especially in a climate like that where, from October to April, it's like drizzling.
Right.
Yeah. So, I think like many things that I have connected with in my professional life, something from my past that like leaves a mark.
Right.
Right. So that left a mark. And
you just start picking up these data points and connecting these dots.
Exactly.
Over time.
I mean, and I, it's kind of comical how I couldn't necessarily like link medical care to these things that made me feel good.
Yeah.
Right. And what's beautiful about practicing medicine now is that I think we have a new awareness of how to like look at that and prescribe it. So anyways, background wise, I feel really fortunate to have started my career in working with the underserved. It taught me a lot about being practical, what works, like what's necessary and maybe what's not necessary. And also, in that world, we had a really unique customer focus, because every client that we served like had to take time off of work. And so we tried to get as much done as we could, like in each visit. And a lot of that also looked like nutrition counseling and, talking about movement and things like that. So fast forward, what do people need? It wasn't just the medically indigent that needed that kind of help. It's, everybody, myself included. Yeah. So, so what brought me to hot and cold? I think, before I met you, it was just an awareness through trainings that I've done in integrative medicine and in cancer care that, warming the body is very healthy.
Yeah.
And, and I think that maybe the first time we met, I was talking to you about like the depression studies where when you heat somebody's core temperature up and hold it there for 90 minutes, it's as good as any, it's way better than any medication we have, but some of the other like more popular tools we have right now, ketogenic diet, psychedelics, ketamine, heating the body. And
something that's simple.
Exactly. And it's like one time and it's durable. So what, again, like when we're talking about being practical and like feeling better, and what's acceptable to people, that seems like a low-hanging fruit.
Yeah. What, when did you start first kind of like thinking about this as a medical treatment and playing around with that? Is there sort of like a patient experience or a prototype that sort of comes to mind where you said, let me actually try this out with a patient and suggest something? I think when people hear the word prescribe, they think that there's a prescription, there's something that's written, and then you take that to the pharmacy and you get handled like a bottle of pills back.
Right.
You've kind of taken prescriptions a little bit more broadly.
Absolutely. So, one thing about kind of the relevance and the validity of any treatment we offer is, it has to be something that people would do.
Yeah.
Right. And I would say in the sauna space, until I met you and this framework came into existence, I didn't really have a place to direct people. And it felt like a heavy lift to tell people, like, get a sauna for your home, right? That's not an accessible option for people. And it was never lost on me in all of those trials I've read that the social aspect of sauna is very important. But to the question about like who's the kind of the index patient, one of the things that people often ask me about is prevention. They want to know how they can live longer and better, right? Not just a number of days, but like great days.
Right.
And
this is lifespan and health span.
Exactly. And so
to throw words around that people hear often.
That's right. And so, so when people that have risk factors for heart disease or neurodegenerative disease, dementia, things like that, want to know what they can do. We talk about nutrition, we talk about movement, but a huge option that shows up is talking about hot in particular, and then cold. And another really interesting population of people that's come up more recently is people that have been perhaps, biohacking's one term, but just using growth hormone.
Mm-hmm.
So the use of human growth hormone for a variety of kind of longevity and or pain indications. And I always have a little bit of pause, like when we're talking about like supplementing people with a hormone, right? Because there's a lot we don't know. And there are protocols that have demonstrated in the use of heat ways to just naturally raise people's growth hormone levels. And so that's always going to be a more interesting option to me than, like a pharmaceutical. Yeah.
I think people read about all these benefits that come from hot and cold. Framework has a bunch listed on our website. What's sort of your go-to like quick hit list of benefits for folks? Like when you think about why is hot good for you? Why is cold good for you? What are the things that you believe most strongly in? Because you can of course find a study that says anything,
right?
And that you think resonate the most with patients and people you talk to about it.
Right. I think at the end of the day, it's about kind of stretching that rubber band of the nervous system. And so when you go into the heat, your body has to adapt. And you're doing it in such a way that you control.
Yeah.
Right. And so when we are in an experience of controlled adaptation, we can choose to get out. Right. So that's a huge kind of a point the nervous system has to understand.
Yeah.
Right. And, so for instance, in heat, there's all kinds of things that are happening to your cardiovascular system. The body is, scrambling a little bit to dilate blood vessels.
Yeah.
It's lowering your blood pressure. It's releasing proteins and chemical messengers, from the cells that because the system is a little bit stressed, the system starts to clean house, right? It's like, you're underperforming, get out. And the cells that are getting that directive, like the underperforming mark, those are ones that don't serve us well over time. Those are precancer cells or actual cancer cells. They are cells that just are using energy, not necessarily helping to kind of lift the load.
Right.
And then similarly with cold, you're getting, anybody that's taken those first couple of steps into the tank knows that there is a kind of a core anchoring grounding experience of doing that. And again, it's voluntary. So much about illness or health is about your nervous system's kind of resilience. I always use that rubber band kind of analogy. And in this controlled environment that's also social, where you get encouragement, you're able to stretch that rubber band in really beautiful ways.
What I really love about your answer, and seems entirely consistent with the way that you practice medicine too, is, you didn't immediately go to, well, there's this study that says if you do this many times a week, you're going to reduce your cardiovascular disease risk by X. And, I think you and I both believe that those things are true.
Yeah.
But where I saw you go was immediately the sort of kind of whole body, whole person thing that's going on, right? Mm-hmm. You talked about things that are going on in a nervous system or, your blood vessels, your cells, but you also talked about choices that you're making and resiliency that you're building. And, you know, in a lot of ways, I think that's one of the biggest benefits of cold is just simply doing something that you don't want to do and regularly doing that over and over again. And I'm sure there's kind of a science answer to that, but, you know, just coming at it from a layperson, it seems just like building really good habits and building confidence in yourself that you can do these things. And then, oh yeah, by the way, you also are getting some of these physiological and brain benefits as well.
Right. That's funny. There seems to be a theme right now of just doing things you don't want to do.
Yeah.
Doing hard things, and how healthy it is for us.
Yeah.
You know, getting over that speed bump of resistance. Yeah. And, you know, and it's true. I mean, to me, sure, a reduction in all-cause mortality of 40%.
Yeah.
Like, we don't really have much that does that, right? Wearing your seatbelt.
This is the proverbial, like, if you could take this pill, people would be taking it, you know, talking about it like it's Ozempic.
Yeah. Oh, I mean, it would be the blockbuster of blockbusters, right? But sometimes maybe that's not enough, right? Because this isn't a passive thing, right? Like for me to invite patients, which I do often, you know, like go and do this hard thing, right? Is a little different than go and take this pill, right? So, you know, inviting people to kind of move from passive into active, and even that is really hard, right? We get into these controlled experiences that, you know, I think for years now we've attempted not to make anything too much, right? And I don't want anybody's sauna or cold plunge experience to be too much.
Yeah.
But, you know, but we want to get up to the edge and kind of like open up the window of tolerance.
Yeah.
Right. Which you have to work at.
And what's going on in the body as you sort of approach? So that building over there is 72 degrees. That's very comfortable.
Mm-hmm.
As our body sits in that temperature, which most of us do sort of all day long, our body looks a certain way.
Yeah.
And then as we dramatically chill our body or heat our body, some other things are going on. How would you sort of describe what happens there? And how does that sort of correlate to this like feeling that we have, right? Like I want to get out, whether that means I'm too hot and I want to get out, or I'm too cold and I want to get out. What's kind of going on, you know, under the hood of our bodies as we move off those temperatures? And then even you and I were talking before we taped this, what's going on when we're at 72 degrees? Because maybe that's not the ideal.
Yeah. Well, maybe we could start there, you know. So when you're in like we live on an earth, right, with seasons. And so this earth with seasons is never static. Right. And even through the course of the day, right? There's day and night, right? And we, you know, I have to move the metaphor from, you know, what people eat now, for instance, is nothing like what people were eating when our genes developed, you know, to kind of like maximize the potential of the environment.
They probably didn't have protein in their water, as an example.
Didn't, no. And in the same way, you know, the environment that our genes adapted in was not 72 degrees. Yeah. Now, are we going to argue that 72 degrees is comfortable? No. Yeah. Because it's nice, right?
As I like to say, we have 50,000 years of human history and 50 years of HVAC history.
Right. Exactly. I mean, I grew up in Memphis in the 80s with no air conditioner. Yeah. Like, it was hot. Yeah. And, you know, oddly enough, like, one could do it, right? It wasn't, like, great, and it was certainly more fun to go into air conditioning, but it was possible. Yeah. And I'm not saying, like, we shouldn't cool people, like, it's dangerous now, like, with the way that the climate is shifting.
But maybe not 24/7, 365.
That's right. That's right. So, you know, this is a pretty new concept in the healthcare literature about thermoneutrality and inflammation.
Okay, that was the word I was coming back to. Thermoneutrality.
Yeah, exactly. So thermo, temperature, neutral, same, just, you know, kind of even keeled, right? And so people are probably familiar with how, you know, it's clear that we all sleep better when we're cooler. Yeah. Right. And then looking very specifically at populations that have liver disease, which is virtually an epidemic in our world right now, this, you know, non-alcohol fatty liver disease. So when they study those animals, and they put them in a thermoneutral environment, they're seeing that, you know, this is a easy way to induce illness is just simply to keep animals at the same temperature. It's fascinating. But so then clearly there was some reason that we adapted to be able to tolerate heat and cold. You know, and if I were to name kind of like a principle about that, you know, a couple of terms come to mind. One is hormesis, right? Like, so stressor, which is, you know, within the realm of what one can handle, right? So a stressor that pushes you towards your edge and then you bring it back, right? And so in a sauna, for instance, that stress is, you know, that heat stress is, you know, I mean, we have very tightly regulated systems that happen at a certain temperature. And we have kind of all kinds of members of the body on the job to kind of raise and lower different mechanisms that are going to preserve that thermoneutrality within the body, right? So, you know, within the body, lots of systems are working hard to do that. So all of that cellular machinery, it's like available, and it's actually meant to be used. And, you know, the intelligence of our design is such that when we use that, it's actually cleaning house, right? It's taking care of things, you know, whereas when we're at just kind of a static, whether it's just like the same food coming in or the same temperature coming in, then the system decays more rapidly, right? So we need these little mini stressors regularly to just buff and polish all the systems, you know. With the work that I do with cancer patients, for instance, you know, we can get really in the weeds on different pathways. You know, there's the mTOR pathway and the mevalonate pathway and the, you know, insulin growth factor pathways. But the one thing that can anchor all of that down would be something like fasting or an experience in a sauna, where it's just stressing the body enough that your systems have to kind of like, it's like, we don't care what's going on. We're going to, you know, clean house.
And it was fasting maybe is the right analogy, or one of them. I was going to ask you sort of what else would you equate this to that maybe is more talked about or has been for longer? And fasting seems maybe like one example of that. Maybe there's others, but this idea that, hey, kind of breaking away from what we do out of that regular routine. Like, of course, you're not going to fast for forever, right? That's starvation. Bad. But a half a day, you know, in sort of a time-restricted eating, intermittent fasting type way has some benefits in certain situations. Sometimes there's maybe reason to go longer than that. Would you sort of say using these hormetic doses of hot and cold kind of analogizes a little bit to some of these things like fasting and maybe some other things where we sort of know that putting a little bit of non-normal stress is good?
Yeah, exactly. We're designed to do that. You know, and I think that, you know, just as we can talk about like people need a mission and a purpose, and, you know, and we feel best when we've done something a little, like we've accomplished something, right? And so these are versions of that. They happen to kind of like bring our whole system along with the accomplishing. And then I was just going to, you know, kind of in the same way with cold, it's, you know, I mean, I'm going to just admit that there's so much to the mystery of the body that can't be explained, right? And I think that the literature, the scientific research, it's all trying to catch up with this. But I think in the same way that we were designed to kind of be able to go without food for a period of time, we're designed to be able to tolerate, you know, periods of cold or periods of hot. And it's because of the design, or perhaps the conditions that were always around, it's something that instead of thinking of it as a negative, the body was like, oh, if that's what we have to do, let's make it part of thriving. You know? You know, for instance, when people fast, and, you know, fasting is hard. Being in the sauna is hard. But as you get through it, there's this, you know, arrival of something wonderful, right? There's a reason that culturally things like fasting were baked into every society on the planet. There's a reason that things like sauna have been around for centuries, in cultural settings, because it did more than just what was happening in the moment.
Yeah. And I mean, to me, just one piece of evidence to that is when you start, for example, cold plunging or using sauna, the second and third and fifth and 10th time feel easier than the first. Mm-hmm. So it's clear that you're building some adaptation and some strength, if you will, around that, much as the same time that the first time you do a workout, or go for a jog or whatever, is harder than when you start to build a little bit of training in around that. And so your body clearly is reacting to those things and remembering how to do it and getting better at doing it each time.
Right.
Which to me, if you weren't supposed to do it, wouldn't be the case. Just sort of like looking at it logically.
Yeah, I completely agree. It makes me think about the, kind of the performance athletes and how, over time they develop efficiency, right? Like the difference between maybe more like me, not you, Alan, you're really a very excellent athlete, but it's like the difference between me, me, a mere mortal, and an Olympian isn't, the kind of efforting, it's the efficiency, right? And so again, as we kind of train ourselves into these spaces of, we're going to push ourselves and then ease up, right? Not overtrain.
Yeah.
Let's
talk a little bit about the social aspect. I remember when you were here a few months ago and we did a sauna talk, right? I think you broke down kind of all the research on the health benefits of hot while we were sitting in that sauna over there.
Yes.
We should do another one of those. But you said something to the effect of, many of the best studies about the health benefits of hot come out of Finland.
Mm-hmm.
And this is probably true from your time in Germany as well. Those are not solo experiences, right? Those are group experiences. There's, friends and strangers alike in there. And I think you said something of, you wouldn't discount and certainly think that those health benefits that sort of show up as cardiovascular disease reduction or stroke or hypertension or Alzheimer's and dementia, maybe a key part of that is the social aspect. Like, I'd love to have you kind of expound on that.
Well, I mean, even kind of like sauna aside, just being able to kind of like connect socially is one of those things that's associated with lower all-cause mortality. It's not something that we normally like prescribe medically. But if we could put it in a pill, everybody would be taking it. And, I think it invites me to just talk a little bit about the idea of co-regulation, right? Because for some people, when we talk about like sauna as a social experience, that can be arousing. Like, I don't feel like being around people. Right. And what I want to kind of name here is that it doesn't have to be like a conversation. So just simply like us being near one another, our nervous systems are co-regulating, right? And it just happens.
Say more about like, what do you mean by co-regulation?
Yeah. So co-regulation is just basically just like it sounds, like we're regulating our nervous systems together. Okay. So we do that passively. There's a lot kind of going on in the background, right? Like I can look at your face. I can see that like your eyes are smiling, right? You don't look, like upset. Right. And, and as a result, and especially because of the many times we've connected, like when I'm around you, like I notice there's like a relaxing. Right. And, whereas maybe if you're around people that are, a little bit more upset or bothered by something, like maybe the grocery store clerk is upset about something, and you can kind of like sense your own kind of regulation in response. Right. And so because people in a sauna are doing something hard on their own, typically there's a lot of like kind of self, regulating that's going on. People are like, kind of,
because everyone's working, you get to kind of draft off of that benefit of we're all working together, or maybe we're experiencing this as pleasurable, or maybe we're experiencing it as a sense of accomplishment or a thing to be pushed through. But literally and sort of metaphorically not alone.
Exactly,
Yeah.
right. So there's a camaraderie that can come without necessarily having to be, kind of built intentionally,
Yeah.
right? And when I think about the description of this, of the sauna culture in Finland, right? These saunas are available. They're kind of a governmental benefit to people. Interesting, again, from my personal background and, care of indigent clients in the past, the sauna equalized socioeconomic differences, right? And so here, in my imagination, it's like there's a corner sauna, and on your way home from work, you can just stop in there. And, how different is that as an experience than maybe if there were a different social experience, like maybe the analogy would be the British pub, where like some people can handle that, but there's a good number of people that weren't able to handle that. And so didn't necessarily lead to health, right? But here's this group of people. So what kind of person like stops in the sauna 4 to 7 times per week, right? And if you go that much and you have that incidental contact with people, you're seeing people that much. Over time, over years, those might be kind of really deep bonds that don't have to happen like, in some artificial way.
Or even if it's a different set of people each time, if you're having those positive interactions, maybe you start to look forward to that and the maybe serendipitous nature of, who's going to be there today. And what kind of interesting people or interesting conversations do I get into? And all of a sudden you've injected something that otherwise is, maybe it's a chore or feels like a thing you're doing because you should, into something that's, pleasurable and desirable.
Totally. I mean, I think a lot of people might have that same feeling about their gym experience, and I would say that there's like very similar attributes to that. Like, maybe at the gym, if you notice somebody like really nailing it, like on a workout, and you don't even have to say anything, but if you just kind of like appreciate, right? Similarly, you can imagine like the OG in the sauna and a newbie comes in and they're like coaching, right? Mentoring, just kind of holding and, offering some kind of support. It's beautiful. I mean, we've mechanized our way out of a lot of incidental contact now. And so building that back in, I think, is critical.
I mean, I think, that was one of my reactions in starting this was society and the things that have happened along the way from, the internet through to the pandemic related changes have kind of pushed us in that one direction of less public spaces, you know, when you can get your food and your groceries delivered and your house is your office and you're doing workouts, online, there's great efficiency benefits at the cost of human interactions. And, I think that's one of the things that was important to me about the way that we've set up framework is putting those in place. And I never thought about it as a health thing. I just thought about it as a fun thing. Like it would just be more fun to have this place where you bump into more people and it isn't yet another siloed experience. Even if you're able to get the hot and the cold, but you're in a room by yourself, that's a different version of it than we're into the room with other people. So, happy to hear that there's more going on there than just fun. But, I sort of came at it just from that perspective.
Well, and I think, for some people, like it is fun to be with others. And I think for others, it's maybe a little bit more of a challenge.
Yeah, sure.
And, and so kind of bringing in the why, right? With a lot of things that I recommend people do that are hard, I want to have like this is why, we're like kind of stacking up the reasons, so that hopefully like after a few experiences, maybe that feedback loop starts to kind of come back and say, oh, actually that was really good. That was really useful. I mean, one thing I love about sauna and cold plunge is that, like let's say there's a day where I'm just kind of low energy, feeling depleted. These are the experiences that in certain ways are passive, but energizing, right? Like in my mind, I always know if I work out, I'm going to feel a lot better. But there are days where it's like, and I really just don't have it. And so I think sauna is a really good option. And then there are people for whom, like maybe because of a joint injury or some other variable, they're just not able to move. And I think there's great evidence that sauna is a surrogate for a workout.
Yeah.
It improves cardiometabolic fitness. And so, another tool in the
just
toolkit.
And that simplicity, right? To your point, it might be easier to kind of talk yourself off the couch to go sit in the sauna.
Yeah.
And then maybe by the time you're there, you can sit in the cold water as well, as compared to knowing that you've got to, lace up the shoes and do something that feels more active on that sort of day. And then, that may get you revving up, and then the exercise follows because you've kind of taken the first step with something that's a little more intermediate, like sitting in the hot or sitting in the cold.
Right. Well, and it's not sloppy seconds, it's like you actually did some stuff.
Yeah.
And I've never left a sauna experience not feeling like I didn't do anything,
Maybe any sort of protocol, people, we talk about this with people a lot, asking kind of what's the right way to do this. Yeah. How often, what temperature, how many times,
right.
There's a lot of those sort of hows once people get to the what and the why. Any that jump out to you, or you're pretty relaxed on this?
Well, I mean, I think the first stop is just like, especially for people that haven't done much sauna or cold plunge, it's like just go and experiment.
Yeah.
Right. So kind of going back to that idea that this is a stressor that it's voluntary, right?
Yeah.
And so, dipping a toe in, kind of seeing how it feels. I remember bringing my dad here, right? And I was just like, all right, Dad, hop in the cold plunge. Yeah. And he was like, boop, and right back out.
Bounced out.
Right?
Yeah.
It was like, I think he was in there for 5 seconds, and he was like, and it was perfect. And he had no interest in a longer cold plunge. Cool. He did it. And he was in the sauna for a long time. And so protocol-wise, once we move beyond that kind of like, all right, we've gotten our experiences, feeling comfortable about that, maybe ready for some more challenging things. Yeah. So just kind of speaking to sauna, for cardiovascular risk reduction. So, now's the time to kind of pull out those numbers, right? 60 to 70% reduction in cardiovascular mortality from doing sauna. Wow. Yeah. Right?
Probably should do that.
And so that study and the kind of the related studies, the dose was at least 4 times a week. Right. And for at least 19 minutes. So we just say 20 minutes. Okay. And they basically kind of like in the literature describe different phases of adaptation that you go through if you're in the sauna that long. So you can imagine, I mean, that's an effort, at 180 degrees to stay in that environment. And it does kind of invite one to go inward, right? Yeah. It can be really beautiful. So 20 minutes and 4 times a week, 4 to 7 times a week. Now, contrast that with, the way framework is set up really for like sauna, cold plunge, like repeated experiences. From what I've read, that is actually more aligned with like a growth hormone release experience. And so I don't know that, the options that people have here are as well studied. But it's okay, right? Because I think it's also true. It's like you're doing that, I think for me, from the beginning, the cold plunge has been the bigger challenge. The literature on that, mostly comes from the sports performance world, trying to reduce things like exercise-induced muscle soreness and recovery. And there are several protocols, from a 40-degree protocol of 3 minutes to a 60-degree protocol of a half hour. Yeah. And again, I think that the literature is not clear enough on what's perfect. Right. So it's really more like, what are you interested in? What are you willing to do?
Yeah. 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 I mean, from my reviews, we have quite a bit of data on sauna usage and studies that I think people feel pretty good about around some of these chronic disease reductions. things like growth hormone, as you spoke about, lighter research on cold, and next to zero research about the combination of the two.
Yeah.
And so, it feels like it's one of the things I found funny when I got into this space. These are things that people have been doing for a very long time, hundreds, thousands of years, right? People jumping in cold water and building, fire heated pits that effectively were saunas. And we know and have a lot of suspicions of how good they are for you, but not as much of the data that we're used to in many other areas of medicine,
right,
on exactly what and why and how.
Yeah, I think that it's coming at a beautiful time where I think, and it's very consumer driven, like, hey, people do these things and it makes them feel better.
Yeah.
Right? These are cultural practices that have been going on for, hundreds, if not thousands of years. And so what's going on behind the curtain, right? So whether it's, fasting or sauna or cold plunge or, various practices that cultures have gotten into, there's some kind of aspect of well-being behind it.
Right.
And it's cool. We're catching up.
I don't want to keep you too much longer, but one question that jumped out that I know is really tied to a lot of work that you do is around cancer. And it was something that struck me the first time that we met, because I feel like, and if you just look at this conversation, we oftentimes talk about these practices in this preventative health manner, right? Like presuming that you're sort of more so looking to stay healthy than, in a more therapeutic type manner. Can you talk a little bit about what you've learned about the use of, I think it's principally hot, but correct me if I'm wrong, around cancer patients and cancer treatment? Because that's something I think has not gotten the airtime that some of these preventative areas have, but I know is something that is near and dear to your heart.
Absolutely. So first of all, cancer, if we go back to earlier in our conversation, we're talking about like getting in a sauna and how metabolically the stress makes the entire system kind of sit up and go, underperforming cells, time for you to go, right? So those experiences basically weed out underperforming cells that are at risk for becoming cancerous.
Yeah.
Right? So cancer, it's a mitochondrial disorder.
Yeah.
Sauna is going to be your mitochondrial challenge, right? And so I think early and often, right, doing things that just help your body clean house, right? It's like opening the door of a closet that's organized is a lot more fun than one that's not.
Yeah.
And so these are practices, alone or in combination with things like intermittent fasting that help the system to optimize. So specifically though with cancer, I was introduced to this.
So you're saying essentially like, this is kind of still in the preventative bucket, right? Like you're doing things like hot and cold and some of these hormetic stresses, of which fasting was another example, sort of are some of the best things we can do to broadly create an environment in our body that is less predisposed to cancer or something.
Exactly. Well, and you can think
please
about,
use your words, but
like all chronic illness, is basically some version of the same thing, which is poor performing cells.
Yeah.
Kind of just getting excess baggage over time.
Yeah.
Right. Not having a chance to clean house and and so whether it's heart disease and the atherogenic particles that like line the blood vessels over time, neurodegenerative disease and the development of these amyloid plaques, cancer and the mitochondrial dysfunction that leads those cells to no longer play by the rules, and metabolic diseases of the liver and endocrine system like diabetes and fatty liver disease. These are all, I think it's just individuals develop these things over time based on their genetic vulnerabilities. Okay. So this is a tool that's going to hit all of those things. And then specifically in the cancer world, so, from the traditional Chinese medicine world, cancer is a cold disease. And so one of the ways, like without sounding wacky, that we treat cancer is to warm people, right? Warming therapies. And if we take that just maybe more into the realm of like science, so think about, I described to you before places in the world where when they give chemotherapy, they do it in a sauna, right? And so those same, kind of things that challenge, kind of press the capacity of a cell to tolerate something. Well, just imagine if you're like, you got to take chemo, right? I mean, or you don't have to, but this, people that opt to take chemo, it's a cell damaging thing, and it's systemic, right? So we want to deliver the lowest possible dose, right? And the cancer cells are vulnerable in certain ways. So they're vulnerable to drugs like platinum-based chemotherapies because they damage the DNA. Well, so if you give that thing to a cell that's stressed already, that's a really good thing, right? Healthy tissue tends to be able to withstand that stuff. So what better way to stress? And so there are different options to give people chemo. You can give people chemo in a sauna. You can give people chemo while they're exercising, like on a bike, in a fasted state, right? They're all just different, and so everybody has a kind of maybe a different, thing they're drawn to or would be acceptable. Like when you have to do something hard, like take chemo. And then similarly, if you think about, chemotherapeutic agents as being in the circulatory system, anything that like speeds up blood flow and opens up the blood vessels is going to improve the ability of that drug to actually make it to the target tissue, right? So again,
now we're talking about the backdrop of things we know, right? Sauna dilates the blood vessels.
So so exercise and heat are like just low-hanging fruit in my book. And what's interesting is that you can actually do, like, for instance, you could do the sauna and then go get your chemo. And then similarly with even radiation therapies, like you can do a sauna experience and then go get your radiation. And the dilation of the tissue, the dilation of the blood vessels around the tissues, delivering a little bit more of an oxidative stress, to the cells, so they're a little bit more vulnerable at the time that they're getting an even greater challenge. It's it's cool.
Is this something that's happening broadly? Is this a new idea? Is it strikes me as something that hasn't gotten talked about, even where I've listened to a lot of information about sauna. The application here is not something that's kind of hit the popular press in places that I've looked.
Well, I think one of the barriers to doing things like this is that like our current delivery system for cancer care is really locked into, kind of like an overarching theme called standard of care, right? And I appreciate the fact that developing protocols and guidelines and studying people it's an enormous undertaking. It's also true that, sauna, because it's an individual, it's like framework's not going to be able to afford to like run a clinical trial with this. Okay. And that's just it's a very common kind of limitation of our current medical research body, which is that they don't fund research on nutrient, like vitamins. These practices wouldn't necessarily be funded, because there's nobody to pay for it. But the practices have been around for a long time, and there's an emerging field of metabolic oncology. Thomas Seyfried, Don D'Agostino, Nasha Winters, these are just people kind of like, I think, especially driven by a lot of clinicians who have cancer themselves. They're like, I've got nothing to lose. It's time to like push this. And and in different parts of the world, it's definitely the standard, right? So if you're in Mexico and you're getting, cancer treatment, you're going to be getting it in a sauna.
No kidding.
If you're in Turkey and you're getting chemo, you're going to be getting it in a sauna.
So not only is the U.S. lagging in overall sauna adoption in terms of just, day-to-day and preventative practices, but also lagging in sort of this area of pairing it with cancer treatment.
We're like, I think the numbers are getting worse, but we're not the best in the world for health outcomes. Right? And so this is part of why, right? And so things like this that are really low risk for harm, should be more broadly embraced. But, and again, as you know, my family's been through a cancer experience. When you bring these questions up in the clinical setting, I think that a couple of things are at play. You've got a busy doctor who hasn't been trained in it, who really doesn't have the time to entertain the conversation. and they have so many kind of other forces, you know, kind of asking for their time and energy,
Right.
that it,
Yeah.
I think the best answer that you can get is often, I don't know anything about that, and, you know, I can't recommend it. Which can feel like a shut door for a lot of people.
Yeah.
Yeah.
Well, I'm glad we were able to open that topic a little bit here, and you know, really encouraging to hear that something that hopefully is kind of becoming more popular in the U.S. as more people are doing this, that we can connect the dots on these two things a little bit more. Let's wrap here, but before we do, can you just introduce a little bit about Mindstream as well, just so folks kind of know your what you're working on in that part of your life?
Okay. Yeah. So Mindstream Integrative Medicine, right down the street, is a full spectrum medical facility. So we take care of people from 9 months of age and older, and we play in the sandbox of Western medicine. So everything that happens in that traditional setting can happen at Mindstream. Yeah. So wellness visits and physicals and things like that. But we've expanded our toolkit. And again, it's, you know, whether we're doing it or we're linking people up with tools like yours, we're, you know, very curious about the things that work.
Yeah.
And so, you know, we take care of a really educated clientele. People often come to us with their ideas. Yeah. And if we don't know,
so it's kind of like how I spent 6 months asking you to be my doctor, and then finally you agreed.
Yeah. No, I mean, and so I think that, you know, fundamentally we bring an air of curiosity to the clinical encounter, and then so we do a lot of work in the mental health space. We have a gym that we opened recently. And we are just increasingly kind of adding to the repertoire of things available. We've trained recently in ketogenic diets for mental health. We've been doing that for cancer patients for a long time. And again, we tend to follow where effectiveness data leads us, right? So if something looks really effective.
Which is a little bit of a wild statement, amazingly, in the medical field, huh?
Yeah, it seems crazy, doesn't it? Yeah. Well, and some, you know, again, I mean, I think that a lot of things that don't get adopted in traditional practice happen because there's no time. Yeah. And that's the thing we're trying to kind of like weed through, and, you know, and just say, hey, if time's the only barrier, then we just have to get more curious about how to fix that. Yeah. Yeah. Well, thank you.
Speaking of time, thank you for carving this out today. I had a few questions in advance, and then just mostly kind of pulled on things that seemed interesting. So thanks for chatting.
Oh,
should we go
awesome.
Do a little bit of the sauna in the cold here?
Let's go do a little sauna.
About 10 feet to our left.
Yes.
All right. Thanks, Amy.
All right. Thanks, Alan.